Rest and sleep disturbances. Alzheimer's disease. Alzheimer's disease causes the brain to shrink, causes the brain to atrophy, and brain cells begin to die. It is progressive, it is irreversible, it is a degenerative neurological disease characterized by loss of cognitive function and disturbance in behavior. Some of the risk factors for Alzheimer's disease include one's age and one's family history. Your potential nursing diagnosis you should be looking out for a client with Alzheimer's disease include self-care deficits, communication impaired, verbal. You could also have incontinence total. So what do you see in your patient with Alzheimer's disease? There's forgetfulness that progresses to the individual's inability to recognize familiar faces, places, and objects. There's depression, paranoia. What's paranoia again? Is an unrealistic distrust of others or a feeling that one is being persecuted. So you have that characteristics in a patient with Alzheimer's disease. He's also combative. He's unable to formulate concepts and think abstractly. He begins to have impulsive behavior, very short attention span. There's this agitation, an increase in physical activity. You also find them wandering at night. They have this night wandering feature you see. And then there's inability to perform activities of daily living. And then the person begins to look unkempt in appearance. There's dysphagia. There's also incontinence. Remember we said you will see incontinence as part of your potential nursing diagnosis. In planning for this patient, you want to support cognitive function. And how can you do that? Provide a calm, predictable environment and present changes gradually. You don't want to put in so many changes all at once to confuse the patient. You want to establish a regular routine. You want to give clear and simple explanations if you need to repeat the same information. Have a clock and calendar to keep reorienting this patient to place and time. You can even color code objects and areas so that way he's able to remember them based on the color markings on them. Again, because of the confusion and the forgetfulness, you want to provide for safety. Use night lights, put a call light within reach so he's able to call for nurses. Again, have the bed set at a low level with half bed rails, so that way you keep him safe. The patient is allowed to smoke with supervision, monitor medications and his food intake. Again, you want to secure the doors leading from the house because of the night wandering we talked about, and that increased physical activity. Again, gently distract and redirect during those wandering behaviors. Avoid restraints because it's going to cause him to become combative. Again, make sure the clients wear identification bracelets or neck chains so that if they get lost, they could be found with the information on those bracelets. And frequently reorient this patient to his surroundings to keep him safe. You also want to reduce anxiety and agitation by reinforcing positive self-image. Again, encourage client to enjoy simple activities like walking, exercising, socializing. Keep the environment simple and familiar. It should also be noise-free. If client experiences catastrophic reaction, like an overreaction to an excessive stimulation, remain calm and stay with the client. Provide distraction such as music, therapeutic touch, just to reduce anxiety and agitation in these clients. You also want to improve communication, reduce noise and distractions. Use clear, easy to understand sentences when you're communicating with this client. If you can, or if you should, provide lists and simple written instructions. Write down your instructions for this client. That way he's able to follow them. Promote independence. You don't want the client dependent on you, especially in activities of daily living. You could organize daily activities into short, achievable steps and allow the client to make choices when appropriate. You want to encourage him as much as possible to participate in self-care activities. Also provide for socialization, encourage letters, visits, phone call, at least 1 or 2 persons at a time. You don't want to give him so much information to process at the same time or too many visitors. You can also provide a pet for this client. Also provide good nutrition. Offer 1 dish at a time to prevent playing with the food. And again, you want to cut the food into small pieces to prevent choking. Assist the client by checking the temperature of the food because you don't want your client to get burnt. If the food is too hot, he's not in that position to make the right decision. So you want to assist him confirm the temperature of the food. Use adaptive equipment as needed for feeding self. We talked about adaptive equipment in the last slide. Again, provide apron or a smock instead of a beep. You know, that is to maintain the client's dignity. You don't want to put a beep on him. Beeps are usually for children, so you want to provide a apron or a smock. Provide balance of activity and rest. Okay, you want to allow the client to work in protected environment. He should get some form of activity. Provide music, back rub to encourage sleep. Discourage long naps during the day so that he's able to sleep at night. Provide teaching and support to caregivers. You could always refer to the Alzheimer's Association, to family support groups, respite care, adult daycare. So you want to provide that support to caregivers. Again, complementary or alternative therapies would also help, like administering ginkgo biloba, which has many health benefits. Is often used to treat mental health conditions, particularly Alzheimer's disease and fatigue. You could also give fish high in omega-3 fatty acids and also 1,000 international units of vitamin E twice daily to help with the memory loss. Again, you want to administer medications like your cholinesterase inhibitors. Also, you could administer your NMDA receptor antagonist antidepressants. Remember, acetylcholine is one of the chemicals that nerve cells use to communicate with one another in the brain, and even in the central nervous system and other areas of the body. And acetylcholine affects learning, it affects memory, it affects other cognitive functions. And it has been shown that reduced levels of acetylcholine in the brain causes some of the symptoms of Alzheimer's disease. So by blocking the enzyme that destroys this acetylcholine with a cholinesterase inhibitor, your anticholinesterase, it helps to increase the concentration of acetylcholine in the brain, and this increase may improve memory and cognitive function. So you always want to remember to use your cholinesterase inhibitors to assist with improving memory and cognitive function. So we're looking at rest and sleep disorders or factors that could affect rest and disorders. So let's look at the elderly clients. Remember, sleep pattern changes with advancing age. The elder you become, your sleep patterns tend to change with age. Levels of deep sleep occur less frequency in the elderly also. Okay, so in assessing the elderly patient, you want to keep in mind they could have difficulty going or getting to sleep. They wake up early in the morning, and there are brief periods of wakefulness even during the night. So you want to keep that at the back of your mind when you're writing the NCLEX. And part of your plan for this patient would be you want to establish a regular schedule for sleeping. Go to bed at the same time, wake up at the same time. Let's have that regular schedule. Again, avoid caffeinated beverages late in the evening. So you want to educate your client on that. You also want to establish a bedtime ritual. Let's say before you go to bed, you take a warm bath, you take a warm milk. So you want to continue with that ritual to keep your body in that state of knowing that, okay, after this, I should be falling asleep or going to bed. Exercise regularly. If unable to sleep, perform quiet activity or even read. The client's bedroom should be well ventilated and humidified. Also, you want to reduce daytime napping and inactivity. Again, evaluate your client for sleep apnea. We'll talk about sleep apnea. And also evaluate for nocturia, which may be disturbing your client and having to wake him up at night to disrupt his sleep. Looking at hospitalized clients, we look at causes of disturbances to rest and sleep in hospitalized clients. One of the major factors will be stress. Another will be drugs, for example, your hypnotics, your barbiturates. Again, being in an unfamiliar environment could also affect sleep and rest. So what's your assessment in this patient that's hospitalized? You will notice restlessness. The patient will be fatigued. He will have this inability to concentrate. He's easily irritated. He could be depressed. There could be hallucinations after extended periods of sleeplessness. And in planning for this client, you want to establish a database on the client's pattern of rest and sleep. What did it used to be? We need to have that database to evaluate what it is today. Again, the nurse should give care in blocks of time to allow uninterrupted periods of rest and sleep. So you want to do everything in blocks. That means I'm going to do the dressing, check vital signs. The two of them, I want to do them at the same time so that I can allow the patient to rest. You don't have to, or you don't want to keep interrupting your patient's sleep or rest. Remove unpleasant odors in the room. Avoid unnecessary light and noises. Again, avoid excessively warm or cool temperatures. So both extremes, excessively warm or excessively cool, you want to avoid them. Reposition your client as appropriate. Again, spend time with your client. This will help to relieve anxiety and will help him rest better. Give unhurried back rub. Take your time to give the client a good back rub to help him rest better. Straighten and replace wrinkled or soiled linen to improve his comfort and help him sleep better. Give warm, non-stimulating beverages. Give pain medications. We prefer you give pain medications than sleep medications because sleep medications would interfere with REM stage of sleep. Again, provide diversionary and occupational activities during the day to relieve boredom and utilize nighttime for sleep. Listen actively to client's concern. Let him verbalize all of his concerns, give a listening ear. And again, explain treatments ahead of time. So that keeps him in a good frame of mind and he knows what to anticipate. Give a thorough orientation to the hospital setting. If he becomes familiar with the environment, he would be able to sleep better. Sleep apnea syndrome. This is a potentially serious sleep disorder in which breathing repeatedly stops and starts. It occurs in older, overweight men, elderly, people with thick necks, and even smokers. One test we could run to confirm sleep apnea would be your polysomnography, EEG, EMG, ECG, oxygen saturation levels, diaphragmatic movement monitored during sleep. So that's what your polysomnography does. It's also called a sleep study. It's a comprehensive test used to diagnose sleep disorders. It records the brain waves during sleep, the oxygen levels in the blood, the heart rate and breathing, as well as eye and leg movements during the study. So what types of sleep apnea do we have? There is the obstructive sleep apnea. Here you have lack of airflow when the pharynx is occluded during sleep. So there's an obstruction, the pharynx is occluded or it's obstructed. You could also have central sleep apnea, where there's a cessation of airflow and respiratory movements. Or you could even have a mix of the two of them within one episode. So it's a combination of the central and the obstructive apnea within an episode where you have this sleep apnea. So what do we see in this patient with sleep apnea? You will notice that this client snores loudly and then stops breathing for 10 seconds or more, and then awakens abruptly with loud snorts. And it happens multiple times throughout the night. He keeps awakening into these episodes. You also notice excessive daytime sleepiness and fatigue because he didn't have a good sleep at night. He will wake up with morning headaches. He could have a sore throat from all of what is happening in the airway. There could be personality and behavioral changes. There could be dysrhythmias, hypertension, increased risk of stroke, myocardial infarction, and even heart failure. In planning for this patient, we want to avoid alcohol and medications that depress upper airway. Again, weight reduction, diet, and activity should be planned. For severe cases, if client is hypoxic and hypercapnic, we will have to place him on continuous positive airway pressure, which is called your CPAP. Or we need to place him on bilevel positive airway pressure, BiPAP. We could also use position fixing devices to prevent the tongue from obstructing the airway and subluxation of the neck. So if we go back to BiPAP, remember the BiPAP is a machine that helps with sleep apnea, and it has two different pressures. It has a higher pressure when the client is breathing in and a lower pressure when the client is breathing out. So the machine is able to alternate the inhalation and exhalation pressures, and that way the bilevel machine encourages the lungs to operate more efficiently. Whereas your CPAP has a compressor or a motor that generates a continuous stream of pressurized air that travels through an air filter into a flexible tube. This tube delivers purified air into a mask. So these are masks that is sealed around the patient's nose or mouth. So as the patient sleeps, the airstream from this CPAP machine pushes against any blockage, opening the airway so that the lungs can receive plenty of oxygen. So that's with your BiPAP and your CPAP. So again, other plans we could have for this patient would be, we can carry out surgery to correct this obstruction. We can also place him on low flow oxygen and tracheostomy if life-threatening dysrhythmias are present. And again, this would only be unplugged only during sleep. Let's look at thyroid disorders. And we'll start with hypothyroidism. Hypothyroidism is a condition in which the thyroid gland doesn't produce enough thyroid hormone. A key giveaway there, hypo. Whereas Myers edema is another term for severely advanced hypothyroidism. And what you generally find in hypothyroidism, there's slowed physical and mental functions. It's almost like everything comes to a slow. In terms of our diagnostic tests for a client with hypothyroidism, like we said, everything comes to a slow. So there's a decrease in basal metabolic rates because the thyroid glands are not producing enough thyroid hormones. Our T3, which is our triiodothyronine level drops. So there's a decrease in T3. There's also a decrease in T4, which is our thyroxine hormone. And then we also find an increase in our thyroid stimulating hormone, because this is trying to cause the thyroid to produce more of this. That's why you see an increased level of the TSH hormone. Like we said, there's decreased activity level. And again, the client is sensitive to cold. Is sensitive to cold. Is not able to tolerate cold, if you put it that way. There's also potential alteration in skin integrity. There's decreased perception of stimuli. You can see weight gain or obesity. There's also potential for respiratory difficulty. There's constipation. There's alopecia or dry hair. The heart rate slows down, which is our bradycardia. The skin is dry. So remember that the skin is dry and also the hair is dry. There's decreased ability to perspire or to sweat, and there could be reproductive problems. So again, remember hypothyroidism, there's hyposecretion of the thyroid hormone, and there's slowed physical and mental functions. On this other side, we have hyperthyroidism. We'll look at that in the next slide. But let's look at our plan for a patient with hypothyroidism. Okay, so you want to pace activities. Allow the client extra time to think, allow him extra time to speak, allow him extra time to act. Remember, we said it's almost like everything is slowing down and coming to a halt. So you want to give him extra time to do all of this. Again, teach him slowly and in simple terms because of the disease condition he's experiencing. Let's have frequent rest periods between activities. Again, maintain room temperature at approximately 75 degrees Fahrenheit. That's where you want to keep the room temperature. Remember, we said there is intolerance to cold. So you want to maintain the room temperature at 75 degrees Fahrenheit. Provide clients with extra clothing and bedding because of the sensitivity to cold. Restrict use of soap and apply lanolin or creams to skin. Why is that? Because we said the skin is dry. Small, frequent feedings. You could also relate that to the constipation we talked about. Again, you could also prevent constipation with a high fiber, high cellulose diet. Increase fluid intake. This would also help with constipation also. We can also give cathartics or stool softeners. Explain to the client that symptoms are reversible with treatment. This would also help the client to relax. Again, you want to explain to the family that client's behavior is part of the condition and will change when treatment begins. Administer drug replacement therapy, like our levothyroxine. So that's your drug replacement. What is it replacing? The thyroid hormones that are not being produced as they should. And the dose is gradually increased and adjusted. Again, when you're administering sedatives, you need to do it carefully because of the risks of respiratory depression. Again, instruct client about causes of myxedema coma. So you want to tell the client that acute illness can cause him to go into myxedema coma. Even surgery can cause him to go into myxedema coma. Chemotherapy can cause him to go into myxedema therapy. Discontinuation of his drug, levothyroxine, can also cause him to go into myxedema coma. Remember, myxedema coma is a loss of brain function as a result of the severe, long-standing low level of thyroid hormones in the blood. So because of the long-standing hypothyroidism, it can go into myxedema coma. So let's look at the opposite extreme of hypothyroidism or myxedema. So remember, hyperthyroidism is a condition in which an overactive thyroid gland is producing an excessive amount of thyroid hormones that circulates in the blood. Remember, hyper means over in Greek word or in Greek language, over. Thyroid hormones include our thyroxine, which is our T4, and triiodothyronine, which is our T3. So you can see there's increased level of T4, increased level of T3, and as a result, the basal metabolic rate is increased. Again, Graves' disease is an immune system disorder that results in the overproduction of thyroid hormones. So when this has lingered for long and there's excessive production, the patient can develop Graves' disease. So in terms of our assessment, you're going to see hyperactivity because of the excess thyroid hormones in the blood. This time around, there's sensitivity to heat. Remember, in hypothyroidism, there's sensitivity to cold. Okay, there's rest and sleep deprivation because the client is so overactive. There's increased perception to smell. Again, you will notice there's weight loss because of the overactivity, there's weight loss. There's again potential for respiratory difficulty, but this time around, we're having diarrhea. Remember, on the other side of the aisle was constipation, but in hyperthyroidism, everything is moving fast. So you can use that to remember that we're going to have diarrhea. The heart rate is also beating fast. There's tachycardia. And there's exophthalmos, which is the bulging of the eyes. There's frequent mood swings. The client is nervous, jittery. And also, you could see fine, soft hair. So that's the bulging eyes over there. And the goiter is obviously visible. And that's the tachycardia we talked about. We remember menstrual periods may occur less often or with longer cycle in hyperthyroidism, but in hypothyroidism, there's possible infertility and an increased risk of miscarriage and irregular menstrual cycle with hypothyroidism. So that's our exophthalmos, or the bulging eyes, for a client with hyperthyroidism. So what's our plan for this client? You want to limit activities to quiet ones. Example, reading, knitting, provide for frequent rest periods. Again, restrict visitors and control choice of roommates because of this client's overactivity. Keep room cool. Remember, what did we say about temperatures? We said there's heat intolerance, so you want to keep the room cool. Give cool clothing also. Avoid stimulants. It's already very active, so you don't want to give anything like coffee. And again, don't be judgmental. Accept the client's behavior. Remember, it's the disease process. Use calm, unhurried manner when caring for clients. Again, interpret the behavior to the family so they understand why their relation is acting the way it is. Administer anti-thyroid medication. We can even carry out irradiation with radioactive iodine. Again, you still need to provide post-thyroidectomy care if they have to carry out thyroidectomy on this client. So you can see the suture line for our thyroidectomy on this client. And again, you could also notice how close by the laryngeal nerves run through the area. So you have your laryngeal nerves. So again, look at the windpipe. So there's possible, all of this could be affected by surgery done in this area. That's our voice box, could also be affected. So what are our post-thyroidectomy care? We want to nurse this client in a low or semi-fowler's position because we want to support the head and neck and shoulders. We don't want him flexing or hyperextending this suture line. Elevate the head of bed to 30 degrees. Put a tracheostomy set and suction supplies at the bedside in case you have an emergency and we need to use it. Give fluids as tolerated. And again, observe for complication. What complications are you looking out for? Laryngeal nerve injury. Remember, we said you could see the laryngeal nerve on this. And how would you know if there's a laryngeal nerve injury? You would notice some hoarseness in the patient's voice. It means the laryngeal nerve might have been impacted or affected during the surgery. So you look out for hoarseness in this patient. Again, another complication could be thyroid toxicosis. What do you see with thyroid toxicosis? Increased temperature, increased pulse, increased heart rate, abdominal pain, diarrhea, confusion, agitation, seizures. So that tells you this patient could be having thyroid toxicosis. Increased temperature, increased pulse, hypertension, abdominal pain, diarrhea, confusion, agitation, seizures. And what treatment would we need to carry out for this client if it's in thyroid toxicosis? You want to put him or cover him with a hypothermia blanket to lower that increased temperature. We want to give oxygen. We also want to give him potassium iodine. We also want to give him PTU, propyl thiouracil. We also want to give him propranolol for the increased for the hypertension and increased heart rate. We also want to give hydrocortisone, acetaminophen. And again, remember, this condition could also be caused by trauma, could also be caused by infection, palpation, and all of that of the thyroid gland. Again, you're looking out for hemorrhage. So always check the back of the neck and upper chest for bleeding. Again, look out for respiratory obstruction because of where the surgery was carried out. Be on the lookout also for tetany. What is tetany again? Tetany would be that movement. So tetany would be the spasms of the leg and feet and overactive neurological reflexes. So that's what you need to look out for. We'll still talk about tetany. And remember, it's a result of decreased calcium from parathyroid involvement. So you also want to check for Chef's-Stokes and Trousseau's sign. So this will be your Trousseau sign, and this will be your Chef's-Stokes sign. And how do you check for that? Remember, Chef's-Stokes sign is described as the twitching of facial muscles in response to tapping over the area of the facial nerves. So when you tap the facial nerves, you will notice twitching of the facial muscles in response to that tapping. And that's a positive Chef's-Stokes sign. Whereas in Trousseau's sign, you will notice carpopedal spasm that results from ischemia. For example, if you notice spasm in the fingers when you induce or as a result of pressure applied to the upper arm, use a blood pressure cuff and apply pressure on this area, and you notice the fingers going into spasm, that's your Trousseau sign. And that tells you this client is in a serious condition. Again, you also want to have your IV calcium gluconate or IV calcium chloride available. Remember, low calcium levels in the blood, which is a complication from thyroid surgery, is usually short-term and it's relatively easy to treat by using this calcium. But if left untreated, the low calcium may be associated with muscle twitching or cramping and can even lead to seizures or heart problems if severe. Again, you could give your analgesics, cold steam inhalations for the sore throat as a result of the surgery. You also want to adjust the client's diet to new metabolic needs. Other antithyroid medications we could give would be your metimazole, your propyltyrosine, we talked about, your potassium iodide, and radioactive iodine. Let's look at hypoparathyroidism. Hypoparathyroidism. This is an uncommon condition in which the body produces abnormally low levels of parathyroid hormone. Remember, parathyroid hormone is key to regulating and maintaining a balance of two key minerals in the body. Calcium is one, and phosphorus. So again, we said it's a decreased secretion of parathyroid hormones. It could be caused post-thyroidectomy. And what would you see in this client? The serum calcium level is decreased, whereas the serum phosphorus level goes up. Our PTH level drops, and you would also carry out X-rays and notice that the bones of this client appears dense, thick. So part of your assessment, you will notice tetany, which is a condition that is due usually to low blood calcium, hypocalcemia, and is characterized by spasm of the hands and the feet. You would also notice cramps. You will notice spasm of the voice box, which is the larynx, and overactive neurological reflexes. There's also muscular irritability. What do you see in the muscles? Muscle cramps, muscle spasms. You also notice carpopedal spasms and clonic convulsions. There's difficulty swallowing. There's paresthesia, laryngeal spasm. The patient becomes anxious, depressed, and easily irritated. There's also tachycardia, and you will notice a positive Chopsteck and positive Trousseau sign. So remember, we talked about the Trousseau sign and the Chopsteck sign in the last slide. So what's your plan for this patient? So remember, these are our parathyroid hormones. So we could, in emergency treatment, you could give calcium chloride or gluconate over 10 to 15 minutes. You could also give calcitrol, 0.5 to 2 milligrams daily if it's an acute case of hypocalcemia. We could also give egocalciferol, 50,000 to 400,000 units daily. While you're on this, observe for tetany, observe for low phosphorus, and put the patient on low phosphorus and high calcium diet. And then we'll look at the last but not the least, hyperparathyroidism, which is when the 4 small glands in the neck, which are the parathyroid glands, remember we talked about them, so you have them, this is 1, 2, 3, 4. So when the parathyroid glands create too much parathyroid hormone in the bloodstream, and overactive parathyroid can be caused by an enlarged gland or as a result of another disease. And when they do occur, you would notice fragile bones. Remember, we said in hypothyroidism, the bones are thick, but in hyperparathyroidism, you notice fragile bones. There's kidney stones and renal calculus. And again, you also notice excessive urination. So like we said, the patient is usually fatigued. There's muscle weakness. There's cardiac dysrhythmias, emotional irritability. We talked about renal calculi. We also see back and joint pains. We could also notice pathological fractures. There could be pancreatitis. The patient could have peptic ulcer. In our diagnostic tests, we would notice elevated serum calcium, hypercalcemia. Our serum phosphorus is low or is decreased. Again, the X-ray shows that the bones appear porous. Like we said, they look fragile. And there is also increased serum PTH levels. In your plan for this patient, you need to remember that there's risk for injury because of the fragile bones. There's impaired urinary elimination because of the renal calculi and the renal involvement. He is also having nutrition less than body requirements. And again, the client could be constipated. For this client, it's important that we relieve pain and prevent formation of renal calculi. How do we do this? We can increase fluid intake. We can offer acid ash juices. Acid ash juices, because this will improve solubility and elimination of calcium. Administer appropriate diets. Again, you want to try as much as possible to prevent fractures. Initiate safety precautions. Also monitor the client's potassium levels because it counteracts the effects of calcium on cardiac muscles. So you want to keep a very good eye on potassium levels. Also provide post-parathyroidectomy care, essentially the same as for thyroidectomy, which we just talked about. Again, you want to give IV furosemide and saline. This will help to promote calcium excretion. We could also give IV phosphorus for rapid lowering of calcium levels. We could also plan for a parathyroidectomy as our last resort in surgery.